Hello, I am Hyun-Chul Park. Today I will present Finger Replantation Book Chapter 11 Subchapter of Vener Aphy, Caution for Washing. In amputation proximal to the distal intraphalangeal joint, vener aphy is possible and necessary as venous drainage can't be maintained by external bleeding technique alone above this level. One artery, one vein repair is enough to keep the finger viable. But the author prefers to repair two arteries and two veins, keeping in the mind that the more the anastomosis the higher the chance of the success. In such cases, if thrombosis occurs in one of the vessel, blood flow can still bypass the thrombosed vessel and the possibility of survival of the finger is more. And chances of late atrophy and cold sensitivity are also less. Arterial anastomosis can easily be checked by watching the back flow of the blood from the veins. But vein needs to be checked indirectly by checking the morphology of the vein distal to the anastomosis or by the squeezing test. It is always preferable to perform to veins anastomosis. In a 50-year-old female with index finger amputation following avulsion injury, arterial aphy was performed, vener aphy was performed. Palmar-sided structures were repaired first at index finger followed by extensor tenar aphy and vener aphy, keeping the hand in pronation. Debridement was performed at postorative 3 weeks. In a 38-year-old male with index finger amputation, flexor tendon tenar aphy was performed, but an additional wound was created at the finger pulp for external bleeding therapy to check the circulation and prevent venous congestion. Post-operative 3 days findings. Post-operative 6 months findings. Thank you very much. Hello, I am Hyun-Chul Park. Today I will present Finger Replantation Book Chapter 11 Vein Subchapter B Vener aphy using additional incisions. Caution for washing. In general, vener aphy is performed as the last procedure in cases of finger replantation. Tension might be noticed at the repair site, or there might be gap in the continuity of the veins. In such cases, the author prefers to ligate the veins on the distal amputated stump and without the venous repair, close the surrounding skin. So we closed the wound first. After checking circulation of the hand, we made additional incisions on the wet space where dorsal veins were expected to be present and performed the venous anastomosis using the dorsal metacarpal and digital veins. Due to surgical site tension, which was producing compression over the anastomost veins, full-thickness skin graft were applied over the 5 venous anastomosis sites harvested from the ipsilateral forearm. A 33-year-old male with complete amputation of the all 4 fingers of left hand. Schematic view of the venous system of hand dorsum and full-thickness skin grafting. At postoperative day 7, the full-thickness skin graft was done on hand dorsum. 3 months after replantation, the patient's hand shows complete viability. Thank you very much.